Currently I work across the adult mental health pathway, across inpatient and community services.
We found that an advanced clinical practitioner could bring a wealth of evidence-based practice to help support some of the patient flow throughout our trust.
The impact of the advanced clinical practitioner role is that it creates capacity within the pathway. The traditional model of clinical decision making and the hierarchy has shifted somewhat. The role is not about medical substitution.
I would say once you had an advanced clinical practitioner, it will make your team stronger and quality of work will improve and the patient safety alongside it as well.
If I could have an advanced clinical practitioner in every single team, I absolutely would. The Trust introduced advanced clinical practice and advanced clinical practitioners back in 2017.
We had to look at our clinical skill mix, particularly in mental health. We didn't really have a strong clinical offer for those who wanted to work through the clinical bandings and grades, i.e. an alternative to a managerial route.
My biggest coping strategy is being able to...
My background's occupational therapy within secure services, and at that point in time, in terms of career progression and developing clinical skills, there weren't many opportunities. So when the advanced clinical practitioner role came up, it was an opportunity to advance clinically, to maintain my skills as an occupational therapist and kind of develop those to extend my kind of scope of practice. So if we can go back a little bit around risks. The role of the advanced clinical practitioner within mental health largely is clinically facing. It's completing extended assessments and reviews, some diagnostic work around the common mental disorders. There can be an element of prescribing if the person's core profession supports that area of practice. So he's consented to that. But every time I work with the MDT really closely, so there is a huge emphasis on clinical leadership and being present, you know, being visible in the services.
They will take away those patients which can be managed by the advanced clinical practitioner, hence reducing the caseload of a consultant, which will be helpful in terms of increasing the capacity within the team.
We are looking at our workforce and looking and recognising that there is a plethora of skilled and talented clinicians out there, and ACP is just one of them. And I think it brings with them an opportunity to work within a multidisciplinary team, to be part of a team. Yes, they're not doctors, but we don't want them to be doctors. We want them to bring something else to the table.
Yeah.
I work with one of the advanced clinical practitioners who brought some leadership skills. She also brought some management and so it's kind of helped not only with the clinical practice role, but also helped with the bit of management, patient flow.
First of all, I'll have a laugh about it and I'll say,
You know, in general hospitals, the advanced clinical practitioner role has been very well established. So I think the mental health is in some way catching up with it.
Well, I don't take it for...
The response from service users and carers has been really positive. We've had feedback such as, you know, feeling like people have been listened to, that they've experienced a really thorough review and assessment and have been happy with the outcome.
For the Warrington Borough, we've invested quite heavily into ACPs. We've got 2 ACPs in training who will qualify in a year and a half. Yes, they will underpin a clinic so we can release a consultant to concentrate on those who are most complex, which is exactly where their level of skill should be aimed at.
Are there any kind of resources?
But there's also so much more we can do with advanced clinical practitioners. I think it would be foolish of us to just align them to replacing a doctor in a clinic. I don't think that would be utilising them to their fullest potential.